If you cannot remember which GI disorder goes with what diet, please stop scrolling and watch this all the way to the end because I'm going to tell you the easiest way possible to remember this. And I guarantee you this will be on your NCLEX because it has been on every single one of the lists that I've gotten the past few days. That is why I'm making this NCLEX Gold. Make sure you like, save, share this out, and tell you exactly what you need to know. No more, no less, no fluff. Let's go. This first one was on somebody's NCLEX yesterday. Peptic ulcer disease. The patho is the stomach lining gets eaten away by acid and pepsin. It's often caused by H. pylori infection or using too much NSAIDs medication. Once that lining is gone, the acid literally burns through the tissues. Why does the diet matter? Because certain foods produce acid, which makes the ulcer worse. So the NCLEX diet tip is avoid spicy foods, caffeine, alcohol, chocolate, smoking, because they all increase acid. No milk. You would think that might coat the stomach, but it doesn't. This temporary soothes it. Later, it's going to increase the acid. They need to eat small, frequent meals, nothing at bedtime because they're gonna go lay down to cause reflux. You have to watch for signs of perforation with PUD. Rigid abdomen. Why? Because it's full of blood. Sudden severe pain. Why? Because it's inflamed and ruptured. Tachycardic and you're gonna be bleeding. Know the sign. Next one is your dumping syndrome. Guaranteed to be on your NCLEX. After gastric surgery, this is very common. Food dumps too quickly into the small intestine, which then pulls fluid into the gut because the food is hypertonic. Think about it. This is what causes the diarrhea, the dizziness, hypotension. The diet matters because we're trying to slow down the gastric emptying, right? And we need to prevent fluid shifts. So they need to have small, high protein, high fat, but low carb meals. Low fluids with their meals because that's too much fluid in them. It's going to cause the dumping syndrome and it's going to cause an excess of fluid shifts. It can have fluids in between meals, not with meals. You really should lie flat after eating. Why? It will slow the gastric emptying. Just think of gravity. When you sit up, it dumps. When you lay down, the slower emptying of the stomach. You have to avoid sugars because this causes the rapid dumping. Think of it as like sugar is speeding up the metabolism, so it's going to speed up the dumping. You don't want that. So have them lie down after meals. Celiac disease, now that is autoimmune reaction in the body. Attacks the intestinal villi when gluten is eaten. The villi absorbs the nutrient, and so there's damage. There's malabsorption, diarrhea, there's weight loss, and there's anemia. Have to remove the trigger in the intestine so it can heal. NCLEX diet tip is going to be no gluten, which includes no barley, no rye, no oats, or wheat. I like to think of it as the acronym BROW. B for barley, rye, oats, and wheat. Avoid the browse. They want to choose rice, corn, potatoes, quinoa. Often think of celiac as the complete opposite of the diverticulitis diet. Remember, they can't eat wheat. Have to monitor for vitamin deficiencies because they have a malabsorption issue. Iron, your folate, your B12 level. Just to wrap this up really quick, I have more of these coming. This is just like part one of this video for diet. NCLEX wants you to be able to connect the patho with the diet. What is inflamed? What is irritating it? What can help heal it? That's what you're thinking, critically thinking as a nurse on the NCLEX. That's how you will answer those tricky questions. They will throw one thing into an answer of a diet and it will make that whole answer wrong. So make sure every single food in the answer that you are choosing is correct. And it's going to help improve that inflamed or allergic reaction. Hope this helps. Stay tuned for part two. Drop it down in the comments if you want me to go over something else. Like, save, share this out. Grab my study notes if you don't have them. There's more information just like this. They're so good. Everybody is using them notes and they're being super successful in their NCLEX and passing. Like, save, share this out. I love you guys. Happy studying.